on any city street. The move allowing the service department to keep all the roads open during the winter weather event.
ProMedica says that patient volumes at its emergency rooms are back to normal. Now, that follows Wednesday when it says that they were filled to capacity with flu cases and injuries from the winter weather. But it is admittedly the calm before the next storm. 13 ABC's Melissa Veitch joins us now with an update. Melissa.
Diane, we did the tour of the area hospitals, emergency rooms, urgent cares, and some of the doctor's offices here. And while they have stabilized as far as volume, it is still very heavy and very intense.
Big breaths for me.
Michelle Hill says the flu hit hard and fast.
It just hit me like a ton of bricks.
Michelle says there was no doubt.
Hurt all over. And it's not just aches and pains. I hurt.
It's the flu.
Can't breathe. I've got a cough and nausea and low-grade fever and, all those wonderful things.
Michelle came to the ProMedica urgent care early because she had the warning symptoms. ProMedica pulmonologist Dr. Bruce Barnett says breathing difficulties need immediate attention.
Breathing really fast, their color's not their normal pink, their lips turn blue, they're working really hard, the sides of their nose are moving in and out.
Any flu symptoms in small children?
In children, they get much sicker, much faster.
Or the elderly or immune compromised.
And what happens with influenza is they die of overwhelming pneumonia.
So those groups, he says, need to be seen immediately at the first sign of symptoms.
You need to get to the emergency department as soon as possible.
ProMedica Dr. David Meyer says while the high risk need ER care, others might consider.
If you're just having the body aches and the headaches and the fever, but not having any other significant symptoms, you're able to keep your liquids down, you can probably manage at home or at best go to an urgent care center or your primary care physician.
And Mercy Health offers yet another option, walk-in clinics.
It's open access. You walk in, don't have to have an appointment.
Mercy Health Dr. Mike Cockley says that can cover a lot of patients.
So it's kind of that step before going to the urgent care or the emergency room. It's just like visiting your primary care doctor's office. It's processed through your insurance. The visit's just the same.
And really, these are just guidelines. Ultimately, you know your body. You know what is right and what feels really worrisome. So if you have a question, immediately get to the emergency room and really make the decisions based on how you feel. Reporting live, Melissa Veitch, 13 ABC Action News. Back to you in the studio.
Toledo police are investigating the death of a 1-year-old, and tonight they say the culprit may be carbon